Good evening. My name is Liz Wright, and today I will be demonstrating to you how to take a manual blood pressure. According to Dr. Peter N. Landless, author of the scholarly article, Hypertension, Stalk the Silent Killer, 50% of Americans who struggle with high blood pressure are on a medication therapy, and of those, only 30% have achieved ideal levels. High blood pressure, also known as hypertension, can cause many health issues, including fatalities. High blood pressure contributes significantly to death rates through strokes, kidney failure, and heart failure. As a registered nurse, knowing how to manually check my patient's blood pressure is an extremely crucial skill that I must excel in. Automated machines are a great resource and very convenient. However, they can often cause false or inaccurate readings, leading to misdiagnosis. Today, we will learn about the equipment that is used, the step-by-step process, what factors can alter your readings, and when to report them to your physician. Knowing how to properly take your own blood pressure can assist you in knowing what is normal for you and what to help you recognize when something should be reported to the physician. You're probably asking yourself, what is blood pressure, or what does it signify? Blood pressure is the amount of force of blood that is exerted through the arteries. It is kind of similar to a water hose. If you squeeze the hose, the pressure increases and the flow decreases. Therefore, when your blood pressure rises, your arteries constrict and less blood flow reaches the body's vital organs, such as the heart, kidneys, lungs, and brain. Hypertension has two risk factors, those that are modifiable and those that are non-modifiable. Non-modifiable risk factors include those that we cannot change. These include your race, ethnicity, sex, family history, and genetic disorders. Modifiable risk factors are those that we can change. These include your diet, your stress management, exercise, smoking, and alcohol consumption. Now that you've been educated on the physiological aspect of blood pressure, we will now begin the demonstrative process. First, I will show you the equipment that is used. You will need a blood pressure cuff that contains a dial and cursor, an inflation bulb, and a control valve. You will also need a stethoscope that contains the diaphragm and the bell. Now I will demonstrate to you the step-by-step process. If I could please have a volunteer. First, you should always wash your hands before touching medical equipment to decrease the growth of bacteria and germs. For the sake of this demonstration, I have washed my hands prior. The first thing that you will do is feel around for your brachial artery. Your brachial artery is located in the forearm closest to your body. So in this case, his would be right about here. You will then take the cuff and wrap it around your arm, securing it firm but not too tight. And this arrow pointing to the artery should line up on the upper arm right about here. You will then tighten your control valve, place the stethoscope in your ears, and place the diaphragm over the location of the artery. Pump the inflation bulb to about 200 millimeters of mercury. Slowly release the control valve and listen for your sounds. The first thump, thump, thump that you hear is your systolic or your top number. The last faint sound that you hear is your diastolic or bottom number. In his case, his blood pressure was 110/70. Thank you for demonstrating. is important to know that a couple of factors can alter your readings if the proper technique is not used. The person should be sitting comfortably with the arm at the level of the heart. Sitting with the arm too high or too low can cause a false high or low blood pressure. The legs should be uncrossed because this can decrease circulation. According to author Lewis of the journal article, Keep Pressure in Check, patients need to be relaxed because someone who is in pain or anxious can often have a higher than usual blood pressure. Now I'll explain to you what the numbers mean. That way you can keep track of your blood pressure and report to your physician if your readings are abnormal. The Joint National Committee on Prevention, Detection, Evaluation, and Treatment of Hypertension monitors and studies trends in hypertension treatment and outcomes. The most recent recommendations of a normal blood pressure are 120/80. Hypertension is considered when the blood pressure is over 140/100, and hypotension, or low blood pressure, is considered when the reading is below 100/80. Each individual is different, and some may have higher or lower than normal blood pressures on a regular basis, and that's okay. Therefore, it is important to regularly check your blood pressure at home and communicate concerns to your physician. In conclusion, today we have learned the step-by-step process in manually checking your blood pressure. We have learned what equipment is used, the steps, what to do to prevent false readings, what the current numbers mean, and when we should report abnormal readings to our physician. I cannot stress to you how important it is to be an advocate for your health. For the sake of yourself, your family, and your friends, do not be victims of the silent killer. By following the steps we learned today and monitoring your blood pressure, you are taking the steps to living a better and healthier life.